Now time to answer some common health questions. Joining us with the answers is News Channel 5's medical expert, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you for coming in today.
Good to see you, Keely. How are you?
Fine.
Good.
I'm well.
Good.
Finally, I can read that with,
Yeah.
or know it without looking at the prompter. I know what you do now. All right, here's our first question. Barbara Walters has the chicken pox. This has been in the news lately. So how do you catch it, and is it dangerous?
Yeah. Well, we all know that chickenpox is pretty common. I mean, it's caused by the varicella zoster virus, which is actually a member of the herpes family. Now, typically 9 out of 10 get it less than 15 years old. It's relatively rare, as you can see, any later in life. Now, it's very contagious. Matter of fact, it's an aerosolized virus. So you typically start off with coughing, sneezing, and secretions. And when you have that, anybody that hasn't had the disease that's in close contact has a 90% chance of getting infected. So the symptoms, in addition, typically you're going to be contagious about 2 days before the rash starts, which is when you have the coughing and the sneezing, and then you're still contagious all the way through until the rash crusts or becomes dry, because the secretions or the fluid in the vesicles is also contagious. Now, it's usually pretty mild. Kids will get it, they get the rash, it resolves, they do fine without complications. Adults, however, have a more severe disease, and they can develop some of the complications like pneumonia, hepatitis, and encephalitis, which can be very serious. Typically, healthy adults will not get those. It's usually going to be adults that are immunocompromised with diabetes, cancer, HIV, or taking medications that lower their immune system. So usually pretty mild, but can be dangerous. 75% of the deaths that occur from chickenpox are going to be in the adult patient population. Really
quickly, Barbara Walters is clearly not a kid, so if you're an adult and you've never had it,
right,
you should get booster shots?
Well, typically it's going to be too late once you already have the disease to get, obviously, any protection from it, but she has to be very vigilant with her health, because she definitely, with her age and possibly some health problems, can certainly be more at risk for complications. So.
All right, thank you, Dr.
You're
Soria.
welcome.
If you have a question for the good doctor, you can write it in by going to our website, WPTV.com. Click on the health link, then scroll down on the right-hand side, and you'll see the form to write your questions. Once again, thank you for coming in. We'll see you next week.